Labels can be a hindrance. Here's why. If we're talking diagnostic labels here, then they can be very useful. Labels are important sometimes for communication. We say, well, look, you have this condition, you have this condition. Okay, all right, oh, good, great, now I've got a label for it. Well, that can be helpful. Why? Because sometimes for people, not really understanding when something's not working in their body is pretty scary. I was working with a patient only the other day, and they were saying how they found it actually really important part of their therapeutic journey for me to give them a little neuropsychoeducation about what was going on in their body, and why it was doing that. Why? Because they thought, oh, I don't feel like I'm going crazy. That makes sense to me, and it was reassuring because it's the uncertainty which can be pretty scary. So to understand what's going on can be really, really helpful for people. And sometimes having a label can be really, really useful for that reason. The problem comes that sometimes we can use that as an abdication of responsibility to do anything about it. Well, I'm therefore poor me and I can't do anything about it, okay, depending on the kind of person that we are. Or we can then go, right, well, okay, well, now I've got a label, so what do we do about it? And the way that medicine tends to work is to compartmentalize things, or traditional Western medicine tends to compartmentalize things. Here is this, and we use this drug regime and this treatment, and we'll do the research to say that for this condition, we will try this exercise regime, this manual therapy approach, and da-da-da-da-da, and the outcomes are ba-ba-ba-ba, therefore we justify that this treatment is the appropriate way to treat this label. And we won't worry about the 20% of people that actually don't get better with that response. And that's, it is useful, and it's useful to be evidence-based in that way. But what's the problem with it? It's not very individual and it's not very specific. And it tends to sort of just go, oh, well, never mind about the 20% that don't get better. I want to be able to take a more individual approach to all of the patients that I work with. I don't treat parts of people, I treat whole people. And I don't treat labels, I treat people, I treat you. What's going on inside your own unique body, with your own unique physiology, neurology, psychology is a completely unique thing. I'm interested to go have an understanding of how the body works. And then when there are disturbances to the way the body is behaving, how that presents itself. And I look at a set of how is the body presenting? And then through my understanding of the body, what is going on? What's going on for you? The problem is that we can't really give that a label other than that's you. And personally, I don't care. So if anybody comes to see me, can we just look at your story? Can we look at your history? And then we'll go, well, this is what's going on, and this is how your body's reacting, and da 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 da. And yes, that sort of might describe you a bit, but I think there's so much more. And one of the problems is we end up with people, as I've done a couple of times this week already, with people who go, well, I've got this condition, this condition, this condition, this condition, this condition. And I go, well, you're either jolly unlucky, or there's something that's going on underneath all of this lot that presents with that label, that label, that label, that label. So are you the label? No, you're not. You're not the label of any of these things. You're you. What is clinical depression? Well, I'll tell you, it's when you tick sufficient boxes out of a 10 questionnaire set of boxes. That's how a diagnosis and a label is arrived at. But it's not very specific, is it? And so that's why I don't like them. In your own healing journey, to look at yourself not as a label, but find somebody, if you want to do the work, find somebody who is able to look at you as an individual and to be able to understand not just their specialist part of I'm a knee surgeon or I'm a gastroenterologist. If you can find somebody who is truly holistic, who can look at the mind, the neurological system and the biology, somebody who has got a good, robust medical training and also understands not just one piece, but that can understand how the whole body works, then I think that's the route to successful healing. And so that's why I feel that labels are, shall we say, a double-edged sword. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. Don't forget to hit the like and subscribe buttons.